Remote work in healthcare is scary, and guess what? It's getting harder and harder to implement. Here are best practices that my healthcare services company is using to thrive in this new area of work.
If you are new to this channel, my name is Theo Harvey, and I'm the CEO of SensorMed, the AI-powered remote care as a service platform for healthcare organizations. I consult with hundreds of medical professionals every year to guide them on best practices and implementing AI solutions and workflows in their current operations. I've worked with large organizations like Cisco Systems, AT&T, the Charles Barkley Organization, Blue Cross Blue Shield, and Google. And my mission is to help healthcare professionals prepare for the new normal in healthcare before it's too late.
At my company, SensorMed, a digital healthcare company, gets a ton of interest in nurses and doctors who are looking to work remotely. And we wish we can hire everyone, but unfortunately, we just don't have the capacity at this time. But likewise, many organizations, they do want to do more with remote work, but they struggle to implement due to complex workflows and not understanding the process to scale effectively. So our hope today is to provide guidance around how we can do it so more healthcare organizations can hire more qualified professionals in a remote work setting. First, your organization must understand how remote communication is key to high patient satisfaction. This is a mindset, and you really have to think through it. Let's talk about telehealth. Telehealth has absolutely transformed healthcare over the past few years. A survey conducted by the American Medical Association, or AMA, in 2020 found that 70% of patients who used telehealth services during the recent pandemic were satisfied with the experience. An additional survey conducted by the Commonwealth Fund in 2020 found that 89% of patients who used telehealth during the pandemic said that they would use it again in the future. So this tells me that telehealth is not going away, because ultimately patients reported feeling more comfortable and connected with the healthcare providers when communicating remotely. This has also improved many medical practices' financial stability, as patients who were more likely to schedule follow-up appointments are able to do so because they felt better connected because of consistent follow-up throughout the year remotely. In cases like this, remote care can ultimately lead to less stress on a practicing physician or nurse practitioner. Secondly, record all training that you do for your staff and create standing operating procedures. In fact, a report by Doseboy, a learning management system provider, found that organizations that use video in their training programs see an average increase of retention rates by 25 to 60%. Training videos and setting standard operating procedures are important because they can provide a visual, interactive way to learn new informative skills. They can help individuals understand complex concepts more easily and retain information better than just reading or listening to a lecture. How many of us have spent hours on YouTube learning a latest skill or technique? These training videos can also be a valuable resource for the employees who need to learn new skills or procedures in a timely and efficient manner. And the most important thing about video training, they can be accessed at any time from any location, where it makes them very convenient for busy schedules or remote work. Moreover, training videos can provide a consistent and standardized approach to learning, ensuring that all employees receive the same information and have the same understanding of processes, so there's no confusion. This can help to reduce errors and improve overall performance and quality. In addition, these training videos and standard operating procedures can also be cost-effective because they eliminate the need for in-person training sessions that tend to happen over and over again because people didn't get the information the first time. Finally, let's focus on empowering individuals to be successful. Human beings are not robots. They need help, they need freedom to do their job well. So the key here is to bring on board individuals of high integrity. Integrity is simply when what a person says is what they do. Due to the nature of remote work, having individuals who communicate clearly what they are working on and understanding the assignment is 85% of ensuring a successful remote organization. At SensorMed, we focus on key questions in the interview process to better understand how they communicate the assignments to their previous employer. We're looking for signs of clear communication, consistent follow-up, and high accountability. Also, the best way for employee empowerment is having clear, measurable goals and targets. We have found having this structure encourages our remote workers to be creative in how they complete the given assignment. A great analogy for this would be if we ask them, how would you get from Florida to California? But we don't give them any details on how they do it. So they can do it via travel by bus, car, train, or plane. It's their choice. As long as they complete the assignment in a timely manner, they have all the freedom in the world to make the decisions they need to do. So in conclusion, having the mindset that remote communication is key to ensuring your patients have the best care. Implement remote training and standard operating procedures, and empower your employees to success to do the things they need to do to be successful. If you like this content, subscribe, like, and comment below.